Earlier, I talked about our treatment philosophy for addiction at New Life Medical Addiction Services, and I think there's going to be a tremendous growth factor going forward. One of the reasons is that the way we deal with addiction issues or substance use disorders, we're very unique, and we're in a space that was previously unoccupied, but a critical space. If you all of a sudden took away all of the primary care doctors, and then what would happen to medicine? Another analogy that I could use, in my career in gastroenterology, if there were no gastroenterologists, well, what would happen? Then what would happen is that we would wait till people got colon cancer. They would go into the hospital. They would need surgery plus minus chemotherapy, and the outcomes would be worse. Well, that's the way addiction is. So we want to be the de facto gastroenterology of addiction, where we're there to prevent things from getting a whole lot worse. So given that fact, our centers are small. They're reproducible, and they should be present in quantities sufficient to service the population. And also, we provide a way to educate patients about what their disease actually is all about, and we also want to convince companies that your highest functioning individuals in the corporation may have substance use disorders, and you may know it, you may not, but it's a lot more effective as a corporation, not only to the individual, obviously, but to a corporation, if those people get early care, and then it's a lot more cost effective to treat that individual rather than to replace them. So we're providing a whole level of services that has been, frankly, in my mind, ignored. And so that's why I think we have ample room for growth. And I think, a lot of these inpatient facilities, if you have five now, you might only need two or three. And that's the same thing with hospital inpatient care. You got to revitalize and revamp the system, because what's happening right now just doesn't work.